Hi guys, welcome back to my YouTube channel, The Facial Now. Okay, so actually I was a bit busy due to my first year final university examinations. Practicals were going on, so now they are over, like 1-2 days before, and I will be continuing with our videos regularly. Okay, I won't be missing any of the day when I won't be posting any videos or anything related to the first year MBBS studies. So we in this topic in this video we'll be dealing about cardiac failures, the types of cardiac failure, the managements of cardiac failure. Also, what is the difference between a myocardial infarction and a cardiac arrest? It is a basic thing all of the medics should know. Okay, so first, starting with cardiac failure. What is a cardiac failure? To define cardiac failure, we need to understand that, see, cardiac failure, it is a medical condition in which the heart fails to pump out an adequate quantity of blood. Okay, the heart fails to pump an adequate quantity of blood to meet the needs of tissue. Easy. Now, the chronic failure can reduce the functioning capacity of the individual heart. Like if it's sudden failure, it results in death. Like if it's chronic failure, it can reduce the functioning capacity of the individual. Okay, now it is of two types, systolic and diastolic. Okay, now what is a systolic heart failure? See, it is reduction in the stroke volume due to weak ventricular contractions. Okay, the ventricular contractions are less. Also, one thing I would like to mention, that heart failure may involve the right ventricle, left ventricle, or both of your ventricles. Okay, it involves the failure of right ventricle, left, or both of the ventricles. Okay, so what we are talking about, systolic failure. What is systolic failure? There is a reduction in the stroke volume due to weak ventricular contraction. Okay, one thing to note apart from this point in systolic cardiac failure is that there is retention of sodium and water due to secretion of your renin and aldosterone. Okay, now what is diastolic failure? It is seen in conditions with reduced elasticity of the myocardium. Okay, in this, see, elasticity of the myocardium is reduced, then high output failure will be there, thus cardiac output is increased, but it is unable to meet the increased needs of the tissue. It is seen as thyrotoxicosis. Okay, what is thyrotoxicosis? It results in, also, like, it is a part of a medical, and also a thiamine deficiency. Okay, comment down which your vitamin is known as a thiamine. Okay, now what are the principles? See, what is management? Management means there are two. Okay, improving the contractility of the heart. Beta blockers reduce the heart rate. Okay, digitalis is administered to aid the failing heart. Okay, very important to find. Digitalis is administered to aid the failing heart. Now, second, reducing the load on the heart. These are the two principles that are used in the management of your cardiac failure. Okay, the load to decrease the load on the heart, diuretics are used. Okay, now just another point. What is I had read this about, what is catheterization? What is your cardiac catheterization? Okay, it is a special technique in which, multi-channel catheter is passed into a chamber of the heart, any chamber of the heart, through the antecubital vein. You know that antecubital vein is also known as the median cubital vein, which is in the extremely sorry, in the cubital fossa, and also the femoral artery. We can use the femoral artery or the antecubital vein. Okay, one vein or this femoral artery. Okay, and why do we do cardiac catheterization? Because it is useful to study the pressure changes, perform coronary angiographies, and analyze your gas contents of blood. What are the contents of different gases in the blood? Okay, echocardiography. What is echocardiography? It is a non-invasive technique. Now, what is the meaning of non-invasive? Without introducing any the machine into your any of the body parts. Okay, non-invasive technique. The word itself makes the meaning clear. Okay, it is a non-invasive technique to evaluate the cardiac function. Also, I would like to mention that UV rays basically are used in the investigation of the heart. Okay, action of heart. Basically, why do we do echocardiography? We need to make sure that your actions of the heart are correct. Okay, they are in sequence. Okay, they are being performed rhythmically, systematically, sequentially. Okay, now the pulses of ultrasonic waves are emitted towards the organ, that is your heart, as I have mentioned earlier also. Now, why it is used? First of all, structure of the heart, action of the heart, how your cardiac muscles are functioning, also the blood flow in your heart. Okay, it is also to measure the velocity and volume of blood flow. How is your blood? Is it turbulent? Is it laminar and stuff? Okay, we had read this about in physics during NEET preparation. Now, what is myocardial infarction and cardiac arrest? Okay, this is the last topic of our today's video. Now, myocardial infarction. Okay, what is myocardial infarction? It is also known as heart attack in our layman language. Okay, it is caused by remember, heart attack is same as myocardial infarction, and cardiac arrest is a different term. A blockage of blood flow to the heart muscle is known as heart attack. Without blood, tissues loses oxygen and dies. If there is a blockage of blood, see, this is your artery. If there is a blockage, it is an artery, it must be supplying to the any of the organ. Now this is on your organ. Okay, this is not getting enough oxygen supply because the blood volume is reduced. Okay, now what will happen to this tissue will undergo necrosis. That what is that? Like tissue loses oxygen and it will result in its death. Easy. Now what is cardiac arrest? Management will do later. Okay, cardiac arrest occurs when heart suddenly and unexpectedly stops pumping. Okay, suddenly and unexpectedly stops pumping. Okay, blood stops flowing to the brain and other vital organs. Okay, and vital organs, like we have read, you must have read it in starvation also in biochemistry. Keeping your blood flow normal to the vital organs is very important, okay, for a living person, but it is not there. Okay, now how do we manage myocardial infarction? Myocardial infarction is managed by aspirin, statin, beta blockers, and medicines such as bp lowering medicines known as the angiotensin converting enzyme inhibitors. Okay, treatment, bypass surgery, or we can also call bypass surgery as PCI, that is precutaneous coronary intervention, which is used to treat the blockages in the coronary artery. Okay, so this was about cardiac failure, your cardiac failure, and the differences between MI and cardiac arrest, also the types of cardiac failure. Do subscribe to my channel, or if you wish not to at this point of time, I can understand, but please let me valuable feedbacks in the comment box. Thank you.